UCP government under Premier Jason Kenney came out with a provincial budget that has proven to be quite unpopular with many Albertans. The budget is predicated upon a story. That story is that debt is spiraling out of control, that deficits and operational spending are out of hand, and that capital is fleeing the province, and there's a lack of optimism in Alberta's future. The budget as well contains two very large unsubstantiated truths that are not backed by evidence. One is that the budget assumes that the economy will grow in leaps and bounds in the coming years, and that is not supported either by the private sector banks, the Bank of Canada, or any other private sector forecaster. And the budget also contains at least verbiage to the effect that there's only modest reductions contained within the budget. And that is a story that's being told about this budget, and it's simply not the case. Some of the reductions are substantial, and we are looking at a massive restructuring in our relationship with our healthcare, education, and other social services programs. So let's first turn our minds to the first story that is being used to justify some of these public policy decisions, which is that the fiscal position is dire, that we are on track to unsustainable levels of debt. Projected by 2023, the Notley plan at third quarter that was released in February of 2019 projected $92 billion in debt. Under the Kenney plan, it's 93. So they are projecting more debt, if debt is the issue, than the Notley government. We need to understand what debt is about. Yes, in 2015 and 16, when the price of oil collapsed, we were looking at a significant deficit. There's no question about that. Jim Prentice was forecasting a deficit. We ran a deficit. I think that's going to be an obvious public policy choice when oil is $25 a barrel, as it was in January of 2016. But a large amount of that debt number, and we're going to put it in context in a minute here for you folks, a large amount of that is capital. It's bridges, roads, hospitals, schools. And so yes, you do borrow money to build 244 schools, which we did over 3.5 years. And I will not apologize for that. I will not apologize for $2.5 billion on a new Calgary Cancer Centre that had been promised since 2002. That serves a number of patients even out of this community. And so that's what's contained in those numbers. But let's look at our debt to GDP ratio. So that is to say, what's our government debt as a proportion or compared to the size of our economy? Because the size of our economy will give us some clues as, can we support this debt? Can we support 92 or 93 billion? 92 under Notley, 93 under Kenney. Our debt to GDP ratio is the lowest by half in the country. And now, not that anyone would want to aspire to Newfoundland's level of indebtedness. That's certainly not what we're arguing here, but you do see the result of a reliance on two different commodities that have since collapsed. One, the cod fishery, and two, oil and gas. And that's where that gets you, which is Newfoundland's debt position. And so, I mean, obviously, our economy, the size of our provincial economy can support this level of borrowing for, in particular, capital. Our debt per capita, so per person, is another measure, again, lowest in the country. And then we turn our minds to deficits. So deficits are the amount of money that you're borrowing in a year in order to cover over your capital or your operating expenditures, right? Under Notley, the 18-19 projected deficit was 6.7. Under Kenney, it's 8.7. So he's borrowing $2 billion more than Rachel had projected when we put out our fiscal update in February. The NDP spending was way out of control. That is another thing that is said often, and it is glibly thrown out there without evidence and without substantiation, so let's have a look at the numbers. I don't want to do too much of a facto-lanche for you, but at the same time, you need to have some of these discussion points for when people tell them to you. Oh, we need to take this kind of bitter-tasting medicine, cuts to our seniors programs, cuts to our education, because our debt and deficit was out of control. Is it? So those are the last 3 years of New Democrat budgets. So 15-16 was a little bit different because of the spike in the number of people on income support and other programs because of the depths of the recession. And then you see what happens, 16, 17, 18, flat. What you see is some nice spikes prior to us coinciding with election years in 2004 and in 2008. So that was Tory spending. In that, you'd have these wild spikes, and then you have our history of spending, which is keeping it to below inflation and population growth, because we thought that that was a reasonable measure. And when we made decisions around investments, those were the constraints that we put on ourselves. And you can see that it is flat. It is not wildly out of control in any way, shape, or form. They also say that the NDP ruined the economy, caused capital to flee the province. Alberta led the country in economic growth in 17, was by some measures tied and by some measures just below BC in 2018. Employment growth was strong in 17 and 18. Retail and wholesale trade grew strongly. And right here in Lethbridge, we actually saw about 5% GDP growth in the census metropolitan area of Lethbridge in 17-18, and that's significant growth. And there's a couple of economists in the audience, and they will tell you that at that point, when you're in the 5-ish% growth area, that you're going to see inflationary impacts and those kinds of things happening in your economy because it's growing quite quickly. So this idea that our community was somehow not benefiting is false. We had a very rapid economic growth. It was strong. We had good employment growth. And the reasons we had those things was because we had investments on the private sector side coming in, whether it was in renewables or agri-food. And we also had investments on the public sector side. We kept our investments in healthcare, education, and post-secondary stable, as you saw from that graph. They were ticking along. And we also invested in capital, which put people to work, in particular in building schools and the expansion to the university. So another favorite argument is that our teachers, our nurses, and others are somehow overpaid. Recent research suggests that this isn't the case either. Overall, Alberta's average weekly earnings are higher than in the rest of the country. The cost of living is higher than in the rest of the country. And still we have a number of economic hangover effects from the boom. And so therefore, we do have, in some areas, higher wages. But you also see that teachers, for example, have taken zeros for the last 4 years. A number of, the same goes with nurses. That money doesn't go as far if they are earning more, and compares poorly to other sectors of the economy. That's the other piece that is really important, is around retention. Again, that economic hangover from the boom, a lot of public sector workers walking across the street for higher wages in the private sector. And so that was what was driving in that time of 2004 to, let's say, 2013, some wage growth in some areas that made it bump up a little bit over our other counterparts in other provinces. But overall, the story is that we compare pretty much apples to apples with other provinces. Inflation, as I was talking about with the cost of living here, CPI, inflation has grown by a factor of 145 in Alberta compared to 136 in Canada. So yes, they earn a little bit more than their neighbors, but their money doesn't go as far. The other argument that you often hear is that Alberta pays more and gets less. This is just not true. Alberta students and schools consistently perform as best or among the best in the country. Our wait times have improved for a number of procedures. This is not to say that the work is done. but continuing to direct targeted resources towards wait time reductions within the public system. For the first 4 years that this was tried in some time, which was between 2015 and 2019, we did see a number of significant reductions. And if we were to continue to do that, rather than introduce chaos and privatization and user fees into the healthcare system, we could continue that work. We have some of the best universities and researchers in the world. We have a number of different social indicators that are better than in other places. And yes, in some areas, we do spend more. For example, on AISH. Our assured income for the severely handicapped rates are higher than in other provinces. In some cases, significantly higher than in other provinces, when people's benefits are just something north of about $1,600 a month here in Alberta. I am not going to stand here and tell you that that's a bad thing. And I don't know why anyone would pretend that it is. Now, there are kind of two big lies in the budget, and I've taken to calling it that. It's mildly unparliamentary, but we're not there, we're here. And the first one is that the economy is going to grow by leaps and bounds due to the corporate tax cut. Now, our provincial forecasts are extremely rosy. They're forecasting 2.5% growth in 2020, for example, and then they've got some other quite significant economic growth forecasts out in the out years, which is always a bit of an exact science, anything more than 12 or 18 months out for those projections. But none of those projections are actually supported by any private sector bank or the Bank of Canada. In fact, the Bank of Canada, when this budget document was written, would have been in September, October, right, that the final touches were being made on this document. At that point, the Bank of Canada came out with a 1.5% growth projection for 2020. So a full point less than what this government proposed. We've got some here. TD is now estimating 1.7, ATB 0.9. When I asked the finance minister about this in estimates debate, I rattled them all off. I said, here, Canadian National Bank is projecting this, ATB this, TD this, the Bank of Canada this, RBC, et cetera, and so on, Scotiabank. I said, what happens if they are all right and you're wrong? Because they are just assuming that all of those private sector banks who make billions off of getting their forecasts right, that they're all wrong. And what happens is more cuts, friends. When the corporate income tax rates don't, or revenues don't come in because the economy isn't performing well, when the personal income tax rate revenues don't come in because the economy isn't performing well, more cuts will come because they will not be able to meet their deficit projections and they will not be able to meet their spending targets. So one of the reasons why even in September the projections were quite low at 1.5, 1.6, 1.7, most of the banks had them at, and then they've downgraded even further. ATB now is essentially projecting flat growth, 0.9 for 2020. One, the reason for this is that when you fire thousands of people and cut program spending, this is a drag on the economy. So that's the first thing, that's real. When you fail to diversify the economy and put all your eggs in one basket, you are going to then have less corporate income tax and less personal income tax revenue because you have fewer people working. And this is a double whammy for Lethbridge. I think it's safe to say that we rode out the recession between 2015 and late 2016 in a way that other jurisdictions didn't, because we had a strong public sector and we had a diversified economy. But now when you have a government who is taking direct aim at both of those things, we are going to potentially feel those effects worse than in other jurisdictions. There is also a claim that there will only be modest effects to programs, and I have heard it claimed over and over again, and I believe Mr. Neudorf made the claim at this microphone before Christmas, that no frontline services or frontline workers will be affected. This is not true. It is simply false. Lethbridge School District, and this is in the last, 8 weeks, right? 15 positions have been lost. Holy Spirit, 15. University of Lethbridge, 19. I learned from the Family Center yesterday, they just gave 25 layoff notices because they don't know what their funding situation is going to be after April 1st. So 25 people, majority of them are women who work with little kids in the 0 to 6 early years, just got their layoff notices on Monday. The other thing I hear quite often from this government is that the education cuts are not really a cut. And they try to obfuscate with this, oh, it's only a small amount of money, this and that. Well, let's talk about the real math on that. Lethbridge School Division took a $6.5 million reduction. It's about a 5% cut. The elimination of the Classroom Improvement Fund, which was a fund that we gave to boards to basically solve problems individually, make their own decisions, reducing class sizes, hiring more EAs for more complex classrooms, whatever the case may be. That meant the removal of 8.5 teaching positions and 7.8 support staff. In the Catholic system here in Lethbridge, it was a $2.75 million reduction. It's about a 4% cut. The board has confirmed 6 teaching positions and more than 10 staff previously funded through that Classroom Improvement Fund. Those are educational assistants for kids with disabilities, is what those people do for a living. So those are the changes, and those are the frontline workers that are being cut, and those are the decisions that school boards are being forced to make at the behest of this government. There is more to come. I believe that Budget 2020 will be even contained within it more austerity measures, and we will begin to see the effects of, before Christmas, there was an announcement of 5,000 public health care jobs that would be eliminated. We know that 46,000 Albertans have already lost their drug coverage due to changes to the seniors' drug plan. A good 25% of Lethbridge is seniors. This will affect them. There are massive changes to public health care being contemplated as we speak through delisting of services, fee-for-service, private clinics, the whole gamut is being considered. An increased Americanization, of course, of our healthcare system, and wholesale privatization of some services is being contemplated right now, in particular ambulance service. I learned from the Health Sciences Association the other day that a privatization of EMS ambulance services is under consideration by this government right now. And we've just seen 50 layoffs among agriculture and forestry staff. Many of these were agriculture researchers. So these were folks that were providing support to, for example, sugar beet growers, or potato growers, or growers of many of our pulse crops or canola crops for specific agricultural practices or applications that were of use to them in southern Alberta. And all of those folks have just lost their jobs, 50 of them. A number of them live in Lethbridge West. This is going to have an effect on our local economy. That's 50 families with an entire income that is not there to buy the new minivan if they need to. They're making their decisions about what they're going to do this summer right now, which camps they're going to put their kids in, how much their disposable income they have. This is going to have an effect on our local economy. I want to tell a couple of stories here because I have given you a bit of a facto lunch in terms of numbers and figures, and I want to talk a little bit about real people because that's actually our job in our office with Keith Gardner, Lisa Lambert, and our new practicum student Deanne, who is here too. Bring them all of your questions, comments, concerns. Our job is to work with people who are facing specific specific issues and work through the system as best we can with them, help to solve problems as best we can, and hear from our community and reflect their concerns as best we can in our work, both within the community and when we go back into session in the legislature. So here's one that came through our door just before Christmas. Larry is over 65, he's retired, and he is on the seniors drug benefit. His spouse was also covered because he is over 65. She has very serious health conditions. She is not over 65. She just lost her coverage. And so now they have to go and find non-group coverage at a cost of about $800 a year. They are on a fixed income. This is a large new cost that, and a new bill to pay that this government just sent them in the mail, effectively. But you know what they didn't do? They didn't help people navigate this at all. And so people are coming into our office going, what do I do? I don't know what to do. When does my coverage run out? When do I have to get new coverage? What kind of coverage? None of those communications were sent by the government to the people that was affected. In other words, the level of respect for 46,000 people previously covered by the Seniors Drug Plan was effectively nil. And that means hardship for ordinary people. There's an economic hardship, and then there's the hardship of just citizenship. That sometimes people can understand changes to programs if it's explained to them, if it's rationalized, if the rationale is real and grounded in reality, but not if it's to pay for a $4.7 billion tax cut, because that's the hole that Mr. Kenney has blown in the budget, and that's why we have to make these cuts, and not if it's not explained to anybody. A simple letter would have sufficed. So our staff helped Larry navigate all of this. He's not happy about his $800 bill, that's for sure. But it took us having to do that where, under normal circumstances, a letter with, an explanation of next steps would have been the respectful thing to do. We have another story right before, just after the budget came out. Opaque and Early Intervention Society, they serve Blackfoot families, but not exclusively Blackfoot families, Indigenous families, but a large number are in fact from the Blackfoot Confederacy here in Lethbridge. They're over just on the north side, just over the bridge on Stafford. And they had, the Urban Initiatives program was cut, so this is a program that helps families make that transition from reserve when they come into town. And a number of their other contracts are now expiring as of March 31st, and they're gonna have to go in and compete and negotiate for two of those contracts. This is going to affect about 50 kids directly, about 100 indirectly. The programs that Opaque delivers keep families together. Before they brought in these programs, what would happen was if mom was away trying to work, kids would sometimes be left alone because they didn't have other family connections here in town. And then the child welfare system would get involved, and then things would become all very complicated and expensive. But what Opaque has done is kept families out of that system, kept families together, and made sure that the kids can focus on their early learning outcomes, that they have a snack, that they have the appropriate educational curriculum for their early learning activities, and so that they are set up for success when they go into the school system at 5 or 6, and that they're set up for success for the rest of their lives. Because we all know the cake is baked by 6 years old. And the work that Opaque does is so crucial to equality of outcome for our Indigenous brothers and sisters in this province, that this is unconscionable, that their programs would be cut, and that they would have to engage in some sort of ridiculous exercise whereby they have to go in and negotiate with a bureaucrat about how many kids they're going to serve and under what conditions, and treating those children like widgets. This begins to border on cruel at some point. There's another side to this story, and that's broken promises. There are broken promises around the Highway 3 bridge that certainly Jason Kenney, in the time of the election campaign, said, oh yeah, the Highway 3 bridge is going to get built. It was nowhere in the capital plan. A little over a year ago, our government came out with a massive new set of investments around the opioid crisis. So there was supportive housing, there was RN supervised detox, or intox rather, an expansion of detox services, an expansion of telehealth programs, an expansion of other opioid agonist therapy programs in the full gamut of care. The money was set aside. The decisions were made, and they were based on consultation with the community of what the community needed. And they were based on also a broader investment in the region, working with Blood Tribe Health and other partners of federal government and others to address the opioid crisis and the human suffering that has come from it. A number of those investments have not flowed. They are delayed. And meanwhile, we have also made reductions due to the reduction in the municipal grants to our law enforcement personnel and to a number of other community mental health and other services. So this is a significant broken promise by this government, and one I think that our community needs to focus on holding them accountable for. There are a number of other rural healthcare initiatives that are on hold or canceled. We won't go too far into those, but suffice to say there's a number of broken promises. And why are we doing this? Why is all of this pain happening? Because there was a $4.7 billion corporate giveaway given to already profitable corporations, which blew a hole in the budget. And of course they can't balance if they give away almost $5 billion. The math doesn't work. As you can see, the deficit is higher, the debt is the same. The outcomes are what they are because of the conveyor belt of cash going into private pockets. Budgets are about priorities, so let's talk about some of ours. If we were to reverse the $4.7 billion gift to profitable corporations and ask the top 1% of wage earners to pay a little more with a 1% increase in their personal taxes. So when I talk about the top 1%, I can guarantee you none of you are in it. It's somewhere around $340,000. So your first $339,000, if you were to get a big promotion tomorrow, that would be taxed at the same rate. But a 1% on the 1% would allow us to stabilize many of our revenues and fund our priorities in healthcare, education, and other priority areas like seniors and childcare. We would reverse the layoffs, we would invest in $25 a day childcare, and we would restore the diversification programs so that those numbers that we saw around projected economic growth could be boosted. They could be boosted if we were diversifying the economy, if we were welcoming in investment in agri-food, in digital media, in artificial intelligence, in renewables, in clean tech. All of those areas that this government has turned their backs on, we can grow the economy both in the oil and gas sector and in those emerging industries if we restore those programs. And we would restore things like annual increases to AISH. We would restore the municipal funding framework, affordable housing. We could create Hometown Alberta, a program to help smaller communities renovate their aging hockey arenas. That was all in our budget projections. And we would end the de-indexation of your personal income tax. The thing is, friends, is that you're all going to be paying more income tax as of this year and certainly as of next year. They have de-indexed, that is to say that your tax brackets are not keeping pace with inflation anymore. So as your income grows, your basic personal exemption doesn't grow, and the other brackets don't grow. So by next year, an ordinary family will be paying between $200 and $300 more in personal Alberta income taxes. That's on top of your property tax increases, which are imminent. That's on top of your higher car insurance rates, higher home insurance rates. That's on top of any new municipal user fees that are going to have to come in. and the myriad of other fees and taxes that will have to be paid by ordinary people because we have a $4.5 billion hole in the budget. So those things we can all do if we take that approach to our budgeting. Our debt would remain the same or lower than the Kenney government. And with that, I will cede the floor back to Mike. Thank you, everyone.